oldest university in Macedonia. It is Kliment Ohridski, or Saint Clement and Ohridski. That is the oldest university, and in that university we have faculties for health and similar university. The healthcare in Macedonia is for free, and we have very good staff, very good doctors. Maybe I can say that we are in healthcare. We are one of the best country around us. Many situations from other countries they came to Macedonia for like operation, or when something is too much complicated. So I'm here as a representative of Embassy of North Macedonia today in Chennai. This is my first time to attend here, and thank you so much for the invitation. We are here as embassy to build the bridges between two countries, between Macedonia and between India. So I hope that in the future, we just start now, in the future, we'll working in that as I told before, in exchanging the programs for the students, or cooperation between the professors, Macedonian professors and Indian professors.
So are you giving any specific invitation to the SRM Institute and SRM General Hospital and Research Center here for their researchers to come there and interact with your experts, and for your experts to come to SRM University?
Yes.
For a collaboration,
yes,
some kind of project.
Exactly. I am for to do it, and I will do it. We have many like conference or seminars in Macedonia who are organized from Macedonian institutes, and who are support from Macedonian government, sometimes from international institutes. So will be our pleasure to use experience from Indian side. Will be our pleasure experts from Indian side, from your institute SRM, to participate in our conference in North Macedonia.
Sir, your country has applied for membership of the European Union. So are there any European standards of health? And what kind of surveys are done in your country, like a national health survey in India? Is there a comparable health survey that you do in Europe and your area of concern?
As I don't know if you know or not, Macedonia is geographically is in Europe, but till now we are not part of Europe. We have already the last more than 10 years status candidate, but very soon we will be part of European countries very soon.
So is there any frontier area of medical research that Macedonian doctors are engaged in, or researchers are engaged in? Is there any frontier area,
yes,
area of cancer?
Yes, just that what I answered, like we have status candidate. It means that we participate in many European projects. So this is big help for us, and big help for region.
National Family Health Survey in Tamil Nadu and Puducherry, how it helps to grow the health in Tamil Nadu and Puducherry?
Will be answered best by the
differs from place to place. It is not the same area it will be different. In one area, one health condition will be higher, but it will be having more diseases. So this data helps us to assess the health status of each area. So we can concentrate more on the health aspect of that area. So we can include people there.
If you are submitting that survey to the government to implement the growth of health.
Yes, sir. Growth of the public.
Okay.
Yeah.
What is the procedure for the survey?
They select volunteers. They go directly to the public. They answer questionnaires. They ask directly to the public. they will answer to their questions. So with that answers, we will come to the conclusion. They will answer them also.
So you already mentioned that 31,000 households.
Yeah, households are
So what is the category?
Category, they have rural and urban they will be. Both
Let me
rural
answer
and
it.
urban.
Sorry, let me answer it. Actually, as I told, this is okay. This is Government of India's project. Actually, IAPS as a nodal agency, they will select randomly from every village and every district. So previously it used to be like NFHS as a like National Family Health Survey, which gives national level estimate. And there is one more thing happened is like district level household survey, which gives district level estimate. So now they combine together to make it a single survey on health. So which is we call it as National Family Health Survey now. So what they will do first, they will do the listing of each and every household, randomly selected villages and urban wards, rural and urban both together. Then from that as a sample list statistically, so they will select randomly 30 to 40 households from each of the villages. From that they will ask a questionnaire related to some key indicators of health as well as education and demographic variables. From that, which is national level representative samples. There is nothing like only one particular region or only one particular group will answer. So it is randomly selected participants, so which will be a national representative on demographic health indicators. So that will become a baseline and it will be the set indicators baseline for future development. So based on that, that will have district level, state level and national level estimates, based on which the government will make the policies. So if suppose national level indicators, if something is less, as like I think Dr. Geeta mentioned clearly, like nutrition. So last NHS 4 survey told us like nutrition is deficient in India, like there is more children with stunning. So then that's why the new program came in like Poshan Abhiyan. So that's what, like these are the one of the example. There are a lot of programs came because of this NHS survey. So that is why it is very, very important, and even the state government, whenever they are going to do a planning or do some projects or implementation of a program, so this will become the base or set indicators based on which they will set a target like, oh, we have to improve on these particular indicators. So that is how it will help.
Not only when we do research, we need baseline data. The National Family Health Survey is the baseline data that we use. It gives us trends. 5 rounds have happened, so we have a trend from 1992, we have a trend. It tells us if diabetes has increased, it tells us if hypertension has gone up. Only this data will give you the trend also.
How do you make it through that health checkup camp like that, or orally they are telling about
Household,
their,
you have to go and take household
Some
interviews and also the blood samples. Yeah.
oral
So there is
interaction.
testing.
Yeah, there are two things. The one is like oral things, like whatever their knowledge, attitude, practice kind of things, and some like anemia, HbA1C, sugar, diabetes, pressure. Those things we will check there itself. So that is it.
For these survey activities, if you are using SRM students or
No, sir.
No.
It is actually we are recruiting people. It's one way to also ensure employment. As field investigator gets paid a monthly salary and a daily allowance. So it's a project. The project actually for 11 months gives employment to people. So
I would like to add one.
yes.
Actually, usually ICDS and the Anganwadi workers also this is the first time we are giving to a private institution for getting the survey. This is a very big thing for a SRM institution.
Going by their explanations, we know that health brings happiness. So rather than calling it as a National Family Health Survey, you can call it National Family Happiness Survey. All right?
Okay.
Thank you.
Thank you.
And you'd like to say?
Administrative purposes has been divided as Tamil Nadu North and Puducherry and Tamil Nadu South. It works up to 9 crores around
The total project cost.
total. Both for Tamil Nadu North and Puducherry and Tamil Nadu South. So one request from all of you, we want the people, all the residents of Tamil Nadu, நாங்க அங்க போறதே give us the cooperation
sure.
and to do this research like
This is the right
Sir
month
said.
also.
மக்களுக்கு பயன்படுத்திக் கொள்ள வேண்டும் என்று உங்களுக்கு வேண்டும்.
யூஸ்வலாக என்ன ஆகுனா
நீங்கள் டைரி எந்த பகுதி போகிறீங்க சார் கிட்ட சொல்லுங்கள் எங்களுக்கு சொல்லுவார்.
நாங்கள் எல்லா தமிழ்நாடு பாண்டிச்சேரி மொத்தமாக எல்லா
இல்லை நீங்கள் டைரி ஒரு எந்த ஏரியாவுக்கு போகிறீங்களோ பிஆர் சார் சொல்லிட்டா எங்களுக்கு போடுவார், நாங்கள் அவங்களுக்கு போட்டுருவோம். அந்த ஏரியாவுக்கு போட்டுருவோம்.
ஓகே தேங்க்யூ.
Thank you so very much. Thank you very much.
Thank you.